Ever hear someone dismiss a veterinary study because it only included 10 or 20 dogs? According to a recent paper by Scott Weiss and colleagues, that's not always fair. In fact, some of the most important advances in veterinary medicine may start with small studies. Here's the problem. Veterinary clinical trials are really expensive and they're time consuming. And unlike human medicine, we often don't have thousands of patients available for enrollment or millions of dollars. So many veterinary studies end up with relatively small sample sizes. Traditionally, critics have argued that these studies are underpowered, but the authors make an interesting point. The value may not be in the statistical significance. The value may be in the data itself. Because a well-designed study involving 20 dogs can contribute important information that later becomes part of a systematic review or a meta-analysis. When multiple small studies are combined, they can answer questions that no single study could ever answer alone. The paper even argues that there are no underpowered studies, just underpowered analysis. That doesn't mean we should stop aiming for larger trials. It means we shouldn't throw away good data simply because the study wasn't perfect. As veterinarians, this is important because much of our evidence base comes from smaller studies. Even if we ignore every study with a limited sample size, we'd lose a huge amount of potentially useful information. So don't ask only how many dogs were in the study. Make sure that you ask, was the study well designed? Was it properly reported? And how does it fit with the rest of the evidence? Because science doesn't usually advance with one perfect study. It advances through many studies that gradually build the bigger picture.